right. Hello, everyone. Welcome to Jiujiteiras. I'm Babs, and today I have a lovely special guest, Celeste Vail, naturopathic doctor. Welcome to the show.
Woo! I'm so excited to be here.
Yes, thank you so much. So, tell us about the naturopathic wellness space.
Totally. So what I usually start with is what I do because as you
Yes.
know, everybody's confused about it, especially being in New Brunswick. So naturopathic medicine, much like conventional medicine, I still do treat, diagnose, and manage patient health concerns. But instead of using pharmaceuticals, I just try to focus more on the natural side of things. So that could be anything from acupuncture to botanical medicine to supplements to IV therapy, diet, lifestyle, all the things. And then obviously I try to get to the root cause as opposed to masking your symptoms with drugs. And that's why honestly most people show up, right?
Yeah. Well, like myself, that found your path. So it was the hormone therapy route, right? Which
Exactly.
Yeah. So tell us a little more about that. I mean, I know I have my experience from what I've
Totally.
been going through, but like what made you kind of like start to focus on that?
It's such a gap in the healthcare system. Really, like women have been falling through the cracks forever. And
Yeah.
then the Women's Health Initiative, when it first came out in the early 2000s, made everyone terrified of hormones, saying it's going to cause breast cancer, it's going to cause you to have a stroke. And then everybody was like, oh no, we got to take everyone off of it. Right? That study was horribly conducted, like horribly done. It's still going on. They actually just stopped it recently. But now they're saying that it does the opposite. It can actually protect against breast cancer, right? And if we think about that, when do most women get cancer? Post menopause, when your hormones are in the gutter, right? So it's like, well, it kind of makes sense now that yes, it could be protective. Now they're finding it's protective against cardiovascular disease, osteoporosis, and it just makes people feel better. That's the main thing, your quality of life. Do you want to be feeling like crap for like 20 plus years? I don't. Like I will be on hormones
Same.
immediately, right? I'm not wasting any time, right? So that would be the main reason for sure.
Okay. And what kind of I guess like with the cuz you also said like the difference between like naturopathic and like your
Hmm.
doctorate, like what did you have to go through to like
Hmm.
become a naturopathic doctor? That was your journey and then kind of where you
Right.
evolved into.
Totally. So I went to UMB, just did my bachelor's as you would in science, super duper fun. Just in St. John though. So and then afterwards, I was actually going to go to conventional medical school. Like I was going to write my MCAT. I was like, this is what I'm gonna do. I was volunteering a bunch at the hospital. I'm like, this is what I want. And then the more I dug into it, the more I was like, holy smokes, you only have like 10 minutes with patients. And a lot of times it's not their fault. The government's like, you have to do this. You have 1,000, 1,500, 2,000 patients, and you have to make sure you see every one of them. Right. And the population's aging, obviously, as well. So it's like they're getting a lot more appointments as you age because you're on more medication and more comorbidities and all of that. Right. And then I also didn't like the fact that the pharmaceutical industry they had the little necks in there a little bit. Right. And I didn't want to feel the pressure of like, oh, and it's almost like you have to, too. Right. Like if you're talking to someone for 10 minutes, and they're, let's say for example they come in, they have high blood pressure, you don't have time to go over diet and lifestyle, you don't have time to go over this is what you can do for supplement wise, you just don't have the time in 10 minutes, but you have the time to give them a blood pressure medication, right? So that would be the main reason why I switched over. And I really just like the fact that it's holistic and I get an hour with each patient. I can really dig into the entire person because I mean, what led you here? Do you know what I mean? Like, and cortisol, for example, is such a big thing right now. And the amount of trauma that people have. And then I'm like, well, why do I have XYZ? I'm like, it's probably from that. Like, I've been seeing that so much recently as well. And it's just so, I just love that I can sit there and unpack it with the person for the whole hour as opposed to saying, okay, bye. See you never. Like, you know
Yeah.
what I mean? That would be the main reason why I went into this instead of the conventional side for sure. And I really love helping people. It's something that I've always wanted to do. I just didn't know it was going to take me to this route, but here I am in a province that hates naturopathic doctors.
But it's good and it's so needed because I mean, I found you through, and I hate using the word gaslighting, but
Mhm.
because there's so many wonderful, talented doctors out there and they get into it
Totally.
because they absolutely care
Mhm.
and want to help heal people. But you know, again, the system is kind of broken. So it's like,
Totally.
you know, you're fine. All of these symptoms I was having, it's like, you're fine. You're fine. There's nothing. Your heart's fine. Your lungs are fine. Your this is fine.
Mm-hmm.
But every day, day in and day out, I remember before seeing you, like, I could sleep and at any point of the day, all day, every day. I
Right.
felt so exhausted all the time.
Right.
And people kept saying, oh, it's because you have kids. I'm like, no. Like, yes, there's
Right.
a certain level of fatigue that comes with
Of
children,
course.
but
Just a
not to the
little.
level of not being able to function. Like, I was
No.
dragging so much through that. And to come to you and actually, let's talk about what your routine looks like. Let's talk about what you're going through. And then, you know,
Hmm.
applying some supplements and looking at the hormones, like what's going on in your blood work. Like, let's do a real deep
Right.
dive. Right. So
Exactly.
it was a really good experience that way. And I feel like, you know, a lot more people that, you
Hmm.
know, are starting to be like, hey, wait, I don't accept that. No, there's nothing wrong
Well,
with me. Like,
Well, exactly. And that's what most people get. It's like, oh, you're a mom. You're just tired because you're a mom. And it's like, yeah, of course you're tired because you're a mom, but like the brain fog, the constant exhaustion where you can't even drag yourself out of bed, like you're sleeping way too much or you're sleeping way too little. Like it's so multifactorial. It's not just, yes, you just have kids. Like, no, because guess what? It's going to keep going. Like if your kids are little, you're probably also going to be tired in 10 years if you're tired right now. Do you know what I mean? So it's just ridiculous. But I also get it's because the government only, like I said, gives them a certain amount of time. So it's like I get why they can't sit down with you for longer than that. And I actually see it too. Like people be like, well, my medical doctor used to be like really attentive. And then you can see them just dwindle as the years progress because they're so burnt out as well. And it's just like everybody's burnt out now in today's society as well because it's like everyone, it's like a rat race.
yeah,
It's like everybody's in a bloody rat race to get to wherever. And I'm like, okay, like what happens when you obtain this goal? Then what? You still feel like crap.
right.
Seriously, like it's ridiculous. But that's why I really like to focus on every aspect, not just one aspect, because then the people feel so much better. And I mean, yes, it takes time because it took a long time to get to where you're at now. So it's going to take time to get to where we need to be. However, people will start to notice small changes and then it's like, okay, we're going in the right direction. Your body's starting to heal from the inside and you're starting to feel better. And it's awesome. I love seeing it. Like I
Yeah.
really do.
It's so true. And it is because
Mhm.
it's the, like you said, it's the more care, it's the more hands on, it's the all around approach. And
Exactly.
yes, it is trial and error because you have to try some things just like life everywhere
100%.
else,
Hmm.
but not giving up on that too. Yeah.
Oh,
Um,
absolutely.
yeah. And like, how are you finding the majority of your patients? Like, are you finding a lot is like deficient in supplements? Is it like
Mm.
hormone? Like, is it just like very variable, or what are you really finding as you've been like in your years of
Yeah.
practicing?
I would say I mean, majority of people that come to me are obviously perimenopausal and postmenopausal women. That would be my forte right now. But there's a lot of digestive issues as well, and a lot of stress. Like those three things, like with the perimenopause included, are the probably the biggest things that I see right now. So yeah, of course the hormones, cortisol included in that, and then the gut health, like the amount of people that come in with well all of the issues at the same time. Again, this is why we have to look at everything because most people don't even feel like they're stressed, but then when I start digging into it, a lot of people have gone through like 10 plus years of just absolute chaos, whether it's from like past abuse relationships, just trauma in their normal life, or just like taking care of an older parent or something. Do you know what I mean? Like all of these things, and I see it all the time. And then the person's like, what's left of me? Right. And it's so like, and that's again when the digestive health comes out and the cortisol gets all messed up, and then their hormones are now they're in perimenopause. And I'm like, oh no, it's a big old bucket of chaos, right? But that's why I love that we have the time to unpack it. And then just seeing people get better just step by step is amazing, really.
Yeah, no, that's awesome.
Mhm.
And it's true because life in general, I mean, it's there's ups and downs, and you kind of just carry on, carry on. Things have happened.
Mhm.
You just keep going, keep going, keep going, and then your body just completely revolts. Which is how for me, you know, hitting 40 was like, yay, you know, it's a rite of passage, and then
Mhm.
41 hit, and
Right?
it just
Game
unraveled. I'm like,
over.
what the hell? I can't push through
Mhm.
anymore.
Mhm.
Like I can't muscle through just
No.
the crap. I had to actually like start to face it. And it was like a slow fall and then kind of picking up the pieces. So, going to see Lauren Richardson for my pelvic
Right.
floor, right?
We love
Going to
Lauren.
therapy, like,
Yes.
like friends, like your support system coming to see you and just like naturopathic ways and just, all that in general.
Yes.
So there's hope. We're saying there's
Yeah.
hope out there.
There's hope, guys, I promise. But that's the thing, it's multifactorial. Right. And then if let's say you did have like a lot of anxiety and a lot of digestive issues coming into things, and then you do hit 40 or that 41, the magic, right? And then all of a sudden, like your hormones go absolutely berserk, right? And this is why I don't test hormones typically in perimenopause, is actually for this reason. I explain it all the time. And that's why I wanted to bring it up here, is because today your estrogen might be at 800, but tomorrow it might be 100. And it literally changes like this every day. Even if you're still having a regular cycle, it might be like absolutely bonkers. So it doesn't really give us an accurate representation. And that's why even a lot of medical doctors will go symptom based, right? But the problem is a lot of the symptom based is anxiety, because a lot of women feel ragey. So like, I don't know what it is, but like, I can't deal with my husband anymore. I hear that all the time. I'm like, I know it is what it is. It's not him. I know that's crazy, but it's not him. And that's why we do symptoms. But the problem is they end up doing antidepressants,
Right.
right? All the time. I see it. And I've been seeing a lot of birth control as well. So then you're on the oral contraceptive pill, which you don't need to be on in perimenopause. Like, yes, it can definitely help alleviate some of the symptoms, of course, but it's not like a bioidentical hormone. Like your estradiol would be like an estrogen patch, for example, and like your oral micronized progesterone. Like those are bioidentical hormones, meaning they mimic your hormones exactly, versus the completely synthetic, which would be like your birth control, IUD, those things, right? And the problem is then your body thinks it's pregnant in a way because the hormones are so much higher, and then you're not ovulating. It's a whole thing. Versus if you're
Okay.
just doing replacement, and if your estrogen is here and then it's here every day, it helps balance it out a bit more. I don't like using the word balancing hormones because they do fluctuate still, and they're always going to fluctuate a little bit until you get postmenopause. Then they take a little bit of a nosedive there. Um, but that's kind of what's happening, right? It's that, let's say like there's like a kind of like a bridge like this, and instead of it going like this in perimenopause, it'll kind of bring it back to more like that reproductive, like nice mini roller coaster, as opposed to the absolute chaotic one.
Right. Which
That
is
makes
how
sense.
I felt.
Well, exactly. A lot of people feel like that. And it's so frustrating when the GPs aren't on board, because of course I can't prescribe in New Brunswick either, because they, again, hate us here. We're not regulated, super duper fine. But I was prescribing when I was in Ontario, and we can prescribe in a lot of other provinces. So we do know how to prescribe hormones. So what I typically would do is just fax people's GPs and say, hey, this is what I would recommend for this person. And I'd say nowadays, like at the beginning, not so much, but in the last 6 months, most GPs have been on board with it, which is amazing, because then you're getting my side of things and you're also getting your medical doctor side of things,
Right.
right? Which is so important. And then you have both of us help, like working with you, helping you. And then, like, that's where I want to be. I want it to be interdisciplinary like that. Like, that's where healthcare should be, is both sides, not one or the other. I really think both should come synergistically together.
Yeah.
But we're getting there. We're baby stepping it, but one step at a time, right?
And it's so interesting too, because when you think
Mm.
about collaboration, that's like such a huge key community. We
Yes,
think about knowing all of your partners and all of your
right.
people that have their specializations that can
Yes.
put all the pieces together. And it's just so funny how there's like can be such these
I know.
silos.
There's such gaps. It's such gaps. It's almost like you go here, but then you also go here separately. That's why I love that we're in an interdisciplinary clinic, right? Like I love that Lauren's here, our pelvic floor physio. We work with Cairo. Shout out to Dan and Eric as well, and Jake on the other side. And then we have massage therapists. We've got therapists upstairs at Rising Tides. Like we really do have everybody in one building, right? And that's what I love about it, is because, okay, like whatever's going on, we can help. We're going to get you better from all angles,
Love it.
literally, which is
It's so
what we
true.
like. That's literally right. Like that's what you need though. Like really, truly. That's what you need to do, right?
Yeah. No. Absolutely. That's
Mm,
awesome.
yeah,
And what can one expect, I guess? Because again, to the listeners coming
yeah,
in that might be on the fence of like hormone therapy,
totally.
like you gave that beautiful description of the bridge and kind of like, it's true, like the
Yeah,
managing more where you're not like rocking or maybe falling off the edge, right?
right. Hmm.
What does that look like from kind of like a person comes in and then
Right.
you kind of put them on the path to that?
So depending where they are, obviously in their perimenopause journey, but let's say like, like you're between 40 and 50, or maybe you're over 50 and maybe you are still having your cycle, maybe you're not at this stage. We go through all the symptoms. Like my appointments do take a whole hour. So if you are coming for perimenopause, we're not just talking about perimenopause. Like we're going over your digestive health, we're going over your diet, lifestyle, all your health history just to see like, okay, first of all, is it safe for you? Right? Because that's really important because it isn't safe for everybody. It's safe for a lot of people, but not everybody. And honestly, not everybody's going to react positively to hormones either. I've seen it firsthand, right? And that's okay. Like a lot of women feel discouraged when they're like, I tried taking the estrogen patch and the oral progesterone and I just can't take it. Like I get like a lot of breast tenderness, or I got more moody, or I started spotting too much, whatever it is. It's fine. There's other ways that we can manage your symptoms. Obviously, hormones are the best and most effective way to manage those symptoms. But again, everybody's different. And we have to look at it from an individual point of view, right? Like we can't just say, like let's say somebody comes in that had a stroke in the last few years, right? Like that person now can't go on estrogen, right? And or they, smoke a pack a day. I'd be like, well, probably not a good idea, right? You just have to weigh the pros and cons. So if someone comes in and they've not had a stroke, they don't smoke any like cigarettes or anything, and they've not had any breast cancer, ovarian cancer themselves, most of the time that person is okay to go on it and they probably will feel benefits. And then let's say they do get put on hormones, expect that it's going to take a little bit of time, right? Like everybody wants a quick fix. I know doesn't exist. The only thing that does that's like out of end. You know what I mean? There's not too many things that are instantaneous. So
Fair.
at least give it that month, right? And I really like to be really upfront with people about the timeline. It's no different than starting an antidepressant either. Like you're not going to feel better like this. Most times it's 6 weeks, right? You got to give the same thing with hormones. You're not going to feel better overnight. Give it at least a month. And then sometimes it takes up to 3 months to get things situated, right? Sometimes it takes even longer. It really just depends on the person. And that's why it's so important to not just go on hormones and say, good, we're done here. No, that's not how this works. You need to do the work. I know people just want to get on hormones and, oh, I just want to lose weight and blah, blah. No, it's not how this works. You still need to do the lifestyle. You still need to do the diet. Still need to go on certain supplements to help with your other aspects of your health. Like we got to manage your cortisol. We still got to manage your digestive health, right? It's not just a one, let's go, you're good to go. Here's your magic pill. I wish it was, but nothing like that exists. Even though Ozempic's not like that. So it's frustrating sometimes to explain to people because some people want that quick fix, which I understand, but it just doesn't exist, right? You need to put in the work still.
Yeah. That's fair.
Period. Right?
Yeah, it was same for me because it took
Yeah.
probably like 4 months before I really
Mhm.
felt the benefits.
Right.
But at the same time, like the
Mhm.
stubborn 20 extra pounds that I just couldn't move the needle on
Right.
was like dealing with my relationship with food and just kind of like unteasing that,
Yes.
right? But having some of the breaks as the hormone therapy started to work, I was able to have more
Right.
energy to put focus
Yes.
into that. So then
Exactly.
I could focus. And then it was the supports. And then you just like,
Right.
okay, I've got this. What's the next thing, right? Because you're gaining more momentum as you kind of like tackle each of these.
Exactly. It stockpiles.
Yeah.
Right. And that is another thing, like you mentioned with the diet, right? Like so many people have a really bad relationship with food because most people are eating on the go. They're watching Netflix in the evening with snacks. That's what everybody does. And I get it. It's your time to relax, to, just kind of unwind, but it's not helping. I'll tell you right now, it's not helping anything you're doing. If
Yeah.
you're having a bowl of nachos or chips or chocolate before bed, I'm like, oh, and that's the hardest thing that people have, like they have the hardest time with that.
Yeah.
And I get it because, and again, a lot of the times I will say it has to do with cortisol because people are like, okay, like there's nothing going on, but I have cravings. Like I need to go grab that bowl of popcorn or grab that chocolate bar. And it's because a lot of people And I've actually seen it like on blood work and everything. Like it's crazy, but they have a spike of cortisol in the evening, right? Which is not normal. You usually have the spike first thing in the morning. It just kind of like tapers off. And then before bed, it should be at its lowest, right? But so many people have a spike before bed and then they get like this crazy craving
Hmm.
between like, like 8 p.m., like, ooh, I'm
That
watching
was me.
TV, right? It's not a
Yeah.
boredom. They do, they kind of go hand in hand. But that's a big thing that we need to work on with people too, is because it's like, okay, like let's say you get on hormones and everything, you're probably still going to have those cravings because your cortisol is still through the roof. So we really need to find out, why is your cortisol this high? And let's work on regulating your nervous system because it's clearly completely dysregulated, which is very common in today's day and age because no one gets a break from anything.
Yeah.
It's go, go, go all the time. Like you're always on your phone. You're getting emails at night, like 10 p.m. You're answering emails. Like, what are you doing? Stop. I'm bad for it too. I get it. I get it. But then you're like exposed to blue light before bed. Most people are on their phones while they're watching TV. It's like, holy smokes. It's chaos. And then they're snacking too, right? So it's like it's almost like nowadays everybody needs like a constant stimulation,
Yes.
right? And no one just meditates anymore. No one just sits there with their thoughts anymore. And that's a big issue nowadays. And that's a big reason why people's cortisol is so dysregulated
Yeah.
as well. And people feel like they need to do everything. Like people have their kids in like 7 different sports and they're running around like a madman. I'm like, why? But why are you doing that? For whom? Do you know
Yeah.
what I mean? Like, anyways, that's one stage of things. And then they're like, well, I got to go on like 7 vacations and I got to go get the new car. I got to like, it's just all the time,
Yeah.
all the time. And again, it comes back to that rat race scenario, right? Everybody's trying to obtain some like crazy goal that doesn't exist. And then even if you got there, it's like, what is it?
Yeah.
Now what? Because you're
It's
still burnt out,
it's so true.
right?
Yeah.
All the time. I see it all the time. And I get it because that's kind of how society tells us to do things now. It's like you got to do everything, but you don't. Like you really don't, and you shouldn't, because you're gonna just end up with a bunch of weight gain because your cortisol is gonna be dysregulated, and you're gonna feel like crap. And then you're gonna hit menopause, perimenopause, or in men, it's like that andropause, like your testosterone starts to decline, and it's gonna be harder. Everything's going to get harder in terms of, weight loss and managing stress and everything. Although a lot of people's lives start to calm down because their kids are older at that stage, like you're getting close to retirement, like things are starting to dwindle down your life, you're left with, okay, but I don't feel good. And I still like, I have extra weight on me. I've gained 30 pounds. Like, do you know what I mean? Like all these things start to stockpile. And then you're left with, okay, what do I do now? And that's where I come in though. That's when you come to see
Exactly.
me and I yell at you. I'm like, this
And
is
you
what
go,
we're
come
gonna
on.
do. We're gonna do this, 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 and this. I won't really yell at you. I'm just teasing.
No, she
But
doesn't.
I get stern sometimes though, because in a funny way, because people need it though. People do need that, really. And people are too soft sometimes with things. And I'm like, no, we need to do X, Y, Z. If you don't do X, Y, Z, we're not gonna get to your goal.
Yeah.
Point blank, right?
And it's good, it's refreshing. You have this realistic
Mhm.
approach to it, right?
Right.
Because then you start actually questioning things. Like I know in our household, like we stopped letting the kids watch TV like during
Right.
the weekdays,
Hmm.
um, and allowing them to be bored. I
I love
actually,
that.
right? Like I work with youth and we have conversations around cell phone usage. And I just,
Yes.
I had a conversation with them this week saying, like, no one knows how to actually be in their body anymore,
Nope.
where you're waiting for the bus and you're not looking at your phone and you're just looking around
Right.
you. And maybe you have an opportunity to talk to someone nearby, right? Make a
Right.
connection, conversation, anything. Listening to what's going on. Do I feel stressed today? Do I
Right.
feel content? Do I need something? There's just so much more of that. And then allowing yourself to say, it's okay to take a day
Right.
to, I don't need to do 20 million things. I can do
Right.
10 of them and then I can put the rest for tomorrow because all the crap's still going to be there.
No,
Like,
exactly. Well, that's just it, right? And I like that you mentioned the phone thing too, because that's one really cool thing I've noticed about the Ivy Lounge that we have now, to get into that, because I always tell people like you can bring your phone, you can watch Netflix, you can have a nap, but everybody's been coming up and having conversations. It's amazing because you don't see that anymore. But I'm telling you, every time people go up there, you're making new relationships with people, you're having all these connections, and then everyone's laughing, having a great time. I'm like, this is great because you'd think, I really thought everybody was gonna be like this. I really did. I thought
yeah.
everybody's gonna be like, yeah, like sitting back. Like, of course, there's still people that do that, and you're welcome to still do that. But it's just really nice to see that, wow, like people have been just coming in and just having conversations.
Yeah.
And it's
I know
about health a lot of the time. It's
I
just
brought
great.
my I brought my book in I don't know how many times and I've never been
Right?
able to read because we end up having conversations. So
Exactly.
it's
Well,
so
that's what
nice
I
to be able to
mean.
connect.
That's it, right? Because you don't get that opportunity very much anymore. Even when you go to restaurants, like it's so loud in there anyways, but I just find most people are just on their phones. And I'm like, and it's the worst when I see it with kids too. Like especially like when they're under 5 and you just see them like on a phone or on their iPad like this all the time.
Yeah.
I get it, you need to utilize it sometimes. Totally. I get it. I have 2 little ones. I understand it gets crazy. But if your child is on the iPad at night or like during the day more than an hour, like that's just setting them up for so much failure. They shouldn't even be on it during the day. I bought one for Vivian, so she's 3.5, only for the plane ride when we went to Florida, right? It's been dead since December.
Nice.
Like, this is what I mean because it's so toxic. Like TV is even better than that because at least you can all watch TV together. Is it the greatest thing? No, but at least you can have a conversation about what you're seeing. If they're on the iPad doing whatever, even if it's brain games or whatever they're doing, they're still individual, they're by themselves. And I really do think this is a big thing that's contributing to society, like anxiety, like social anxiety, because people are so much like in their own space all the time. Like that connection's gone with
Yeah.
people. And I'm like, and like, no wonder kids have all these issues. Like the amount of kids that have come in who are like under 10, who have anxiety all of a sudden, depression, social anxiety. Like, where's this coming from?
Yeah.
Right. And I do think a lot of it, of course, it's like behavior with the parents too. They're seeing it at school, whatever. I know it's multifactorial, but if they're attached to a screen all the time, you're just setting them up for failure. Right. And I hate to see it. I see it all the time. And you see kids with crazy behavioral issues. Like, yeah, little like kids are shits. Shocking. Like, but
Facts.
right. I mean, of course, like they're all gonna go through the terrible twos and three-nagers and blah blah blah. Like my kid's crazy sometimes. I get it. But if you're giving them and you're feeding them these electronics to calm them down, I'm doing air quotes. If you're not watching, it's making it so much worse.
Yeah.
Because what's gonna happen is when you take that away, they're gonna lose their minds. And
Mine
like,
did.
what? Right? That's what
They
happens.
I was like addiction right there. That's
Right.
an addiction withdrawal because we and to no
Mhm.
fault, don't blame any parents because you
No, I don't either.
excuse
I
me,
get it.
you just try and do what you can do. And like the
Hmm.
mornings were chaotic. So we put the TV on while we're
Totally.
getting ready. In the
Yep.
evening while we're making supper, we put the TV
I
on,
get
right?
it.
So
Yeah.
not allowing them to be bored and be creative. And so I realized that when I started taking it away, they were like
Right.
losing their damn minds. So
Yes.
I had to be
I
like, and now they don't even ask for it. Like they'll
right.
come in, they'll play. Sometimes they'll complain they're bored. I'm like, great, be bored. Like you'll
Yep.
come up with something.
They do. They
You're very
always
privileged to
do.
have toys and have art
Right.
supplies and things you can, or come help me.
Right.
Like,
Exactly. Well, that's
or
just it, right? And it's gonna take some time to get used to if people are starting to get their kids away from the electronics and everything. It takes time and they will freak out at first. And I'm not saying it's bad all the time because they're not. Electronics can obviously have a benefit as well. And like, yes, sometimes you need to. Like, I'll be cooking supper sometimes. I'm like, get off of me. And then I'll have to put it on. Like, so it's no fault to anybody at all because I do it. It's just how much are you doing it? Right. And it's just, I'm just trying to get kids, systems regulated so I don't see a bunch of anxiety because kids should not be on antidepressants before, like, they're so young. Like, the amount of kids who are in like middle school and high school on antidepressants is insane. Like, and it's not okay. Why are you on them? They can't even regulate their own systems because no kid does at that age. That's when you're learning, how do I regulate my emotions? Right? That's when they're learning to do that. If you're on antidepressant, which literally depresses the system, you're not going to be able to regulate when you're an adult. And that's what's scaring me because they might come off it one day and then what?
yeah.
Right? They're going to be a lot of therapy. That's
Yeah.
for sure. But at the same time, and I guess there's obviously time and place. I'm not saying they're not needed because yes, some kids will need antidepressants. And I'm only talking about kids here, not adults, right? And there is a time and place for everything because every kid goes through something different, and that's totally fair. But majority of kids, if they're, their home life's okay, school life's okay, nothing's really going on, it's just more of like an internal, like figure that out with them first. Bring them to therapy, talk with them about it, figure it out what is happening that's causing you to be this way. right? Like it's really important to dig into, again, coming back to the root cause thing, because that's what I'm all about. It's so important because you don't want your kids to be dependent on something. And you don't want them to not be like, functioning adults at some point and not be able to regulate themselves.
Yeah,
Because we see a lot of them.
I
You
bet.
can get cray cray,
Yeah.
right?
And you're probably dealing with a lot of the parents in the same
I
instance. You
am.
talk about cortisol levels and anxiety
Yes.
as an adult. And
Yes.
like you
Hmm.
said, adults having to deal with ailing parents and
Right.
then kids that have these behavioral issues or on
Right.
antidepressants and like trying to manage all of that too, right?
Right.
So there's a
Absolutely. And
huge cascading effect there that takes place.
there really is, right? And again, it is about what you're showing your kids as well, right? Like how are you behaving at home, And again, we're all folk, man. I'm not always calm at home. I'm not a calm person. Okay, in case that wasn't obvious. So I get it. Like I yell sometimes, like my yeah, I've done all the things, all the parental things, the no's and the go's, right? Right? As we all have. But at the end of the day, it's like you're just gonna do your best. That's all you can really do. But I just wanted to get it out there just because I've been seeing so many kids with these issues. So I did want to bring it up just, and I do treat pediatrics as well, obviously. And I have got like, definitely helped kids a lot with ADHD, with anxiety, with all of that. So I just wanted to let people know that I do see kids too, because a lot of people don't know that. So there you go.
Well, and it's
Not all
good.
women's health.
It's not a way, but that
Yeah.
affects when you think about the mothers that, and I mean, not to say that doesn't affect fathers as well too, right? Because it affects
Right.
both parents. But when you think about all of this, like you kept saying, you
Hmm.
get to the root of the problem. So if mom coming in, dad's coming in, they've got anxiety, they've got stuff that's
Right.
out of whack, and then you've got two kids that you're dealing with on top of all of these other things. So
Exactly.
it makes sense that it kind of all comes around together.
Absolutely. What I've even been learning myself, because I'm notorious for, being home and trying to like, oh, I got to clean this and I got to cook supper and I got to be on my phone and answer emails. You know what I mean? I've just been like reflecting on that a lot too and being like, okay, you know what? Like, I got to stop this. And I've just been sitting down with them and playing with them a lot more. And then you're getting bonding time with your kids. You're showing your kids that, hey, like you are important. You're my focus right now, because I don't think people realize that that's what kids see. They see if you're on your, let's say they're trying to talk to you, you're like this on your phone. They're like, okay, the phone's more important than me. That's what they're going to think. Right. So that's why it's so important. Put it down. It's okay. You don't need to answer that email right now. It's all right. It's going to be fine. And then just sit down and play with them. It makes such a big difference. And you'll feel so much better too, right? Because that bond with them is also going to help decrease your cortisol, because you're sitting there interacting with your kid. You're learning about your child too. They're learning about you. It's such a cool thing to see. And it's so simple, but nobody does it anymore as much. Well, not as much. Obviously, people still, they play with your kids, obviously,
Yeah.
but to really sit down and not be like, hyper focused on the phones and whatever else is going on. Like, yes, the kitchen will get cleaned eventually. I get it. I freak out when things aren't clean. I get it. It's really difficult to get away from that. But when you start doing it, it becomes easier and easier. And then you're gonna be like, wow, I just sat down and played with my kid for an hour. We made forts and
Yeah.
whatever you're doing, but it's so much better. And then you get to act like a kid again. So it's kind
Yeah.
of fun.
No, it's so true. And then going back to what you
Mhm.
said about, excuse me, I have a cold. The
Mhm.
self care stuff too, like recognizing the different
Yeah.
points where your cortisol levels. Like one thing that I had a weird fixate, like
Mm.
hang up on was jujitsu. Going
Mhm.
to class, and it had to have a babysitter. Like I had to be able to go
Right.
without the kids, and
Right.
recognizing that our babysitter is absolutely lovely, but she's in rugby, she's in soccer, she has a part
Right.
time job at the mall. So like all of a sudden I saw the gap at to which my training was coming into play, which was
Mhm.
playing on me because I had this guilt, and then that
Right.
causes, you're ruminating thoughts. So I gave up and said, okay, Christopher, we're just going to take the kids with us. We're going to let them stay up late. We're going to ask the coach. And the
Mhm.
whole team was super duper supportive. Like half of them are babysitting our children
Love
while we're
that. Oh,
while
that's
we're in class,
awesome.
right?
That's
And it's like not
great.
perfect, right?
No,
Because
but still.
it was
Mhm.
like the laughing the other day. I was like, trying to like escape a choke, and Sterling comes running over and goes, "Mom, you're losing." Like I'm like, I
Oh
know,
no, you're
buddy.
like, thank you so much for letting me know. I didn't know that. As you're choking, I didn't know.
Right. But it was good because after the week, I'm like, okay, I can still take care of me. I can
Right.
show them that taking care of ourselves is important. like,
Mhm.
you know, because my oldest does do jujitsu too. And like, this is
Right.
what you are going to be working towards. This is where
Right.
you will get if you stick to something. So, sorry for all
Exactly.
those of you that don't have kids, because I know we went on a tangent there. But
Like,
also,
yeah.
like, for those of you that do have it and struggle, like, just little things like that, I'm like, okay, I know
Yes.
we can get to class and I don't need to have that as a barrier. And there's people there. And if it's, you know, it's okay. Done is better than perfect. My husband always says that done is better
It's
than
so
perfect.
true. But it really is. Shout out. But honestly, it's so true, right? Because really, like, and then your kids will see you prioritizing, your health is such a big thing. And then they're like, oh, well, mom's exercising and dad's exercising. So I probably should do that too.
Yeah.
Like monkey see, monkey do. It's a real thing,
That's it.
right?
Yeah.
Like if you're sitting there, like not, if you're super sedentary and like, you're not doing any activities with your kids or whatever, you're eating super unclean, like they're going to also develop those habits,
Yeah.
right? That's why it's so important to instill it when they're little. So then they will carry it forward.
That's right. That's
And
the goal.
because everybody wants their kids to be healthy, I would imagine anyway. But you got to show them that you're healthy too. Because if you don't show them, they're not, how would they be healthy if you're not healthy? I don't know how that would even work.
Yeah. Yeah.
Like,
And you can't put all the pressure on the schools too, because that's unfair, right? Like they
no,
have so much pressure on them.
they
So,
have enough pressure. Don't put
yeah.
any pressure on them. They're just there to teach your child education. You are there to teach a child everything else. I think that's what people forget sometimes. Like you still have to teach your kids, guys.
Oh,
Like
yeah.
90% of this stuff will be taught by you. Let's be real. Like it's like 10% from them. So like they're not going to be sitting there like trying to do equations when they're like, trying to deal with life struggles.
Right.
They're important for different things, but you still have to put in the work elsewhere.
Yeah.
But I
All
get it.
the
A lot
work.
of all, it's so much fun. We love
All the
it.
work.
All of the work, all of the time. But it's okay, right?
um, I wanted to backtrack a little bit because we
Yeah.
kind of started the whole IV thing and
Oh,
talking about
yes.
community. And so
Totally.
this has been a new journey. Well, not super new, but new
Hmm.
enough a journey for
Yeah.
you entering these wonderful services within your practice. So talk about
Yeah.
IV therapy.
We love the
I'm
IV
also get my
therapy.
usual.
Yeah, you should have came in today if you got a cold. That would have
Oh,
helped with
that's true.
that too. So basically what we do is I'm sure everybody's seen it on reality shows now. It's all over the bloody place with people going in for hangovers. That's not why we do it, but yes, can it help technically? Because it's electrolytes, right? But most people, if you're feeling run down, or let's say you're getting sick a lot and your immune system is overrun, or maybe you just want a little pep, right? That's what I would be like, let's do the Myers cocktail. Let's cut you in for IV therapy. So the Myers cocktail has vitamin C, it's got all your B vitamins, it's got magnesium, and it has calcium. Right. So that's what most people come in for. But a new therapy that I just started offering within the last few months, which I don't know, I don't think you've got this one yet, NAD.
No, not yet.
Oh, you're not yet. You might have to get it next time. So, if we think back to grade 12 biology with our mitochondria, so our little powerhouses of the cells, right? So, they convert NAD to ATP, which is our energy source. So, what they're finding is a lot of people that have like chronic fatigue syndrome, even Alzheimer's, Parkinson's, even obesity, that they're finding this in a lot of conditions, anxiety, ADHD, all of those people have less mitochondria than the average person, right? So if you're getting NAD therapy, you're actually boosting the amount of mitochondria, you're boosting that ATP in your body, and it really can replenish it all. Like they're finding a lot more on it for actual like helping prevent dementia as well, which is super cool.
Wow.
Right. So that's why I like to do it. It also increases your telomere length, which is, your little chromosomes, all of those, right? So it literally is anti-aging, right? Which is super duper cool. And most people notice it the same day they get that done. That's why I love it. People will be like in there with the NAD and like, holy smokes, like I just feel so energetic now.
Wow.
It's crazy. It's intense, I will say, because I get it done as well. And when you're getting it done, you can feel a little bit like bluish, I'll say, panicky. So I should tell you that too, anyways. It almost feels like you're gonna have an anxiety attack, like a panic attack in your chest a little bit. If the drip rate's too quick, we just slow the drip rate down, it usually will go away. But it's only during therapy. As soon as it's done, you feel amazing. And it takes about like, let's say you're coming in to get the NAD, it will take a bit longer, probably will take you a whole hour,
Okay.
right? Versus just Myers is like 30 minutes.
Right.
right? Depending on your drip rate. But again, like it's the benefits afterwards that you're going to notice the most of. Like most people, when they get the Myers, they don't notice a whole lot. Like people will feel a little bit more energetic or they won't get as sick, obviously. So if you're looking just for that, beautiful. But if you want that extra boost, then I typically would recommend the NAD, right? We can all use a little anti-aging in here, right? I love it, honestly. I love getting it done. It's such a cool therapy, and I love that I can offer it now for people. And a lot of people have been very receptive to it. Most people come once a month. Like it's been really, really successful. And I just think everybody should at least try it one time.
Yeah.
It's covered by insurance too, you guys.
Yeah, so checking your provider. Um, what like because I know for me, like with the Myers cocktail, I've noticed a huge difference like the couple of days after
Right.
where normally like I know like my kind of like my peaks and valleys on energy
Totally.
levels during the day, and I always
Mhm.
find that like the day and the next day after I'm just like zooming around, like I can just like accomplish so much more. And then
Right.
I've been like, "Oh, I do have more energy." So
Yeah.
it's been a huge benefit and also has lessened it's because we have germ factories in the house, so it's like
Yeah,
lessened
I
some of
know.
the effects of like the colds and the flus coming through the house, which has been
Right.
wonderful. So, but can you
Right.
tell our listeners like
Mm.
kind of like the benefits, like the difference for the Myers cocktail, like the vitamins versus like supplements, like kind of
Hmm.
like
So a lot of people
why the
also
IVs could be a better route for them?
totally. So, I mean, for one, obviously, it's directly into your veins. So you feel it right away. You're bypassing your whole digestive system, which a lot of people, if they have any sort of gut issues like IBS or Crohn's or ulcerative colitis or, diverticulitis, anything like that, you're probably going to have an absorption issue, right? So this bypasses all of that. It goes right into your bloodstream. So you get it all in you right then and there, right? And again, I do it a lot for people going away as well because instead of you trying to like load up on vitamins because it's stuck, you also can only like orally absorb like 2000 milligrams of vitamin C before it's like no point really, right? So it just really gives you that boost. Or if someone's getting sick, it'd be a really good time to come in. So flu and cold season, that would be a really good time. Or it seems to happen all year now a lot of the time. So a lot of people before trips, like I said, or when they're getting sick, that would be a really good time to come in to get one as well. But if someone's coming in for the NAD as well, that would be like for anything,
Okay.
right? But again, like it's pretty much for everybody. There's really not that many contraindications. So a really cool one actually that I want to mention that I've been starting to do is wound healing. It can actually speed up wound healing. So what I do, because I make all my bags here myself, which I probably should add in because a lot of places around here are not, and I make them myself. So you just add more zinc and glutathione as well. So I do that in a separate bag as well. Because if you see in a lot of places, like if you go to spas or what have you, like they are doing those pre-made bags and they have glutathione, which is an antioxidant, but you're not supposed to mix the two together like directly in with the vitamins because it disintegrates
Okay.
almost immediately. So I do it at the end, but that actually can help with wound healing a lot. So it's really cool because a lot of people coming in with like injuries and they'll be like, oh, the recovery is like bam, or another big one that I've been noticing lately too is like period cramps. They can go away almost instantly with it. With that, because I just do higher doses of magnesium in the bag. And the NAD as well can help tremendously with like it's crazy.
Wow.
There's so many, it's just so cool. Like people think it's just for one thing, but it's like it's almost for everything, really. Because I can make the bag whatever it needs to be. We can add whatever we need in there, but the wound healing one's been really cool too. So I wanted to mention that because I've been doing a lot more of that recently. We love all the cool things. There's so many ways we can do it for you. It's individualized.
I love it. I love it.
Right?
It's good. I joke around about it being my juice box for the day
It
when I
is
come in to
it is your
visit.
juice box. I tell everybody it's a little juice box for you here, hey? But again, like everybody's been I don't think there's been any negative effects from anybody really, except for the NAD when you're first getting it done. But I have to slow mine right down too, so I get it. It's just intense, but
I
aside
would
from
probably
that,
be
no.
that person, the low and
Everybody
slow,
is.
because
Everybody is, honestly. It's a big molecule, right? So to get it into your cells, like it does feel like, what is this? But it's fine because it works really well. So
that's
I'm just
really
gonna add it. We're going sneak it into your bag next time.
next time I'll be like, why do I feel so heated? What's going on?
Like, oh, it's just your mitochondria. Don't worry.
And you've really grown the practice too
Yes.
with the therapy as well. Like now you've got a bunch more staff, like supportive staff there, and have
Oh
been able
yeah.
to put way more offerings in. So
Exactly. Yeah. We do offer the IV clinics every Friday and every second Thursday. And then if somebody wants to come in, if they're already my patient, they don't need to do any sort of like initial, they're already good. But if they're not a patient, it's like a $25 IV initial consult. It takes about 10 minutes. It's done over the phone or virtually. It's just to make sure that you don't have any contraindications. And then I just book you in. A lot of times I can do it the same day too, if they do it on like a Thursday or Friday. So it's really nice because it's just like, we can get you in so quick because we double book people too now that we have the nurses. So it's really nice. It's been really nice. And a lot, like I said, a lot of people have been benefiting from it so much. So it's just nice that I can add something else to help with people's health. Right. That's all I'm trying to do. Just trying to get you guys better.
no, and it's awesome. Like you guys have such a great team there, and it's
Mm,
like such an inspiration.
mm,
To model that. So like if other people out there, especially those of
yeah.
you listening, if you're kind of like having these symptoms, feeling frustrated, have tried things
Right.
not working, like wherever you are, there's people like Celeste, if you're not in the
Hmm.
province or you're further out, checking these things to look at these
Yes.
alternatives to help with the healing process.
Absolutely. And then if you're in another province, we're probably regulated, so it'll be a lot easier to find an actual naturopathic doctor as well. I do want to mention too, just because we're not regulated in New Brunswick, if anybody's ever trying to find like, oh, is this person an actual naturopathic doctor? You can go on its N band, like that site. That's where all the licensed naturopathic doctors are in New Brunswick. So you can really see like, is this person? Because I've run into a lot of people just saying they're naturopaths who are not naturopathic doctors. And you want to see a naturopathic doctor, you guys. There's only a few of us in this area. So please, if you're gonna go, if it's not me, that's fine. But just make sure that they're actually licensed. That's all I ask.
Yeah, because you go through a lot more rigorous like
Yes.
education and
Oh yeah. 8 years versus whatever they do online. I'm not sure.
okay.
But you just want to make sure that you get somebody who knows what they're doing. That's all. I just don't want to us to have a bad name in New Brunswick, right? Like we're really trying to build it so that we get regulated and so that like we can partner more with medical doctors. So I'm just trying to make sure that that's really known to people that there's a difference between a licensed naturopathic doctor and one who's not. So I just want to mention that at the end to be like, guys, just know who you're seeing. That's all I'm asking.
Yeah. Protect yourself, right? That's important because
Right.
especially when you're going down this path of like
Yes.
alternates, right? I mean, there's risk
Yes.
to everything. You go to the
Hmm.
doctor and you get a pill and there's risk to
Right.
that, right? Because of the
Totally.
pharmaceutical companies and all the other factors, right? So
Absolutely.
it's knowing like who's
Who are you
licensed and
seeing?
who's, yeah, like the
Yeah.
regulations around it.
Well, yeah, because anything can be dangerous, like you said, right? So you just really want to make sure. And there's so many contraindications with people's meds. So you really need somebody who knows what they're doing. Do you know what I mean? Especially if you're really trying to get better. You don't want to be like, you don't want to have to start over again. You don't want to take any steps backwards,
Yeah.
right? We want to go forward always.
Always. I love it. I love it.
Yes.
Well, that's so awesome. Well, thank you so much for your time. I
Of
really
course.
appreciate you being with me today and
Yes. Thank you
so
so
many
much for
cool tips.
having me. Oh, it was so good.
Yes.
Our conversations are always good, and I knew it would be. So I was like, this has been awesome. Thank you so much.
And now you have a whole bunch of IV bags to make up for the day.
Now I gotta go make my happy bags.
Awesome. Well, I hope you have a wonderful day. Thank you so much again. And I will
You as
probably see you in a
well.
few weeks.
I will see you in a few weeks for your IV with the NAD.
Perfect.